Literally, she's gonna come on this call like any second. Oh, guys. So I have this entire calendar of medications that they sent me that talks through for the next 2 weeks. I'm gonna be giving myself shots in the morning and night. I have so many questions. I wanna know whether or not they can be combined in one syringe, or I'm really giving myself like 4 different injections twice a day, so like 8 shots a day, which is insane. And then she's gonna talk through side effects, I'm sure, talk through administration, what to expect from it all. And so I'm excited to talk to her. I am nervous. We're gonna do a Zoom call, or it's gonna be online. I'm gonna see if I can record it for you so you can also meet her. I love this type of stuff. Oh my gosh, and I've been trying to do all my own research, so I understand what it's like to be a patient, because to find on Google, you hear so many conflicting different things, and this is not my specialty. So I'm loving the fact that they have like laid out for me, like all the recommendations for what I take, the business office hours, infectious disease panel, cycle medications, my responsibilities while in cycle. So they want me to monitor my medication stock daily to make sure I have enough till my next one. I love the pharmacy I've been working with. They literally, I can text them and then they deliver my medications free of charge same day. And so for me to be having to go pick up my medications, pick up my trigger shot eventually, seems so annoying. This is already so much of going to the clinic and being on top of everything. It's like one more thing in my life, just feels like a lot. And so I love that they're delivering my meds today. They also have a nurse on call 24/7. I think the girl I'm talking to today, Gabriela, she is on call today. So which I love this. This feels so personalized that if I have a question, I have a patient liaison, I have Gabriela, who's the nurse, and then Dr. Ghadir as needed to help kind of hold my hand through this process. So I've like had random questions here and there. I texted Layla this morning, and then I'm gonna meet with Gabriela today and ask her all my questions. But they have this on-call nurse page system. And if they have an emergency, or like I'm experiencing some sort of crazy weird side effects, God forbid, knock on wood, then I can talk to the nurse and then she can call the doctor. So I'm feeling like I'm covered. I just am so curious to talk to her about all of the side effects of these, and then what I can and can't do, / what I should expect as far as like work goes, because this patient has not delivered. She's still very pregnant. I got a text like a couple nights ago when I was having my freak out that she was having contractions, and I was like, God, in the name of Jesus, send her into labor. And she is very much still pregnant, and we are very much still looking at an induction on Thursday at midnight, which today is Monday. And so we're gonna have to flex and flow, and I will definitely be giving myself medication injections in the hospital while she's in labor and having to time them with her pushing and delivery and whatnot. So this is crazy. Also, like, I need a cooler because some of this stuff has to be frozen. Oh my God. I have so many questions. I'm waiting for this call. I'm actually online right now waiting for Gabriela, and my meds just came. There's so many. So I'm gonna open them up, which is actually really good timing, because then she can like actually talk me through everything. Oh boy. Literally, she's gonna come on this call like any second. Oh, guys. Oh, I mean, I suppose for $5,000, it better be this much. This is alcohol swabs, and that is a huge needle. Oh my God, I'm like waiting for her to come. Alcohol swabs and little insulin syringes. I like these syringes way better. Those are way different. Like, look at this thing. Hold on, you have to see this. We're gonna get interrupted by this call, but holy moly, look at that needle. I'm sorry. I have to give that to myself? There's no way. There is absolutely no way. I'm gonna have to phone a friend. They're all this big. I thought they were insulin needles. Are these sub-Q injections, or are they, oh my God. Insulin, these are the ones I want. These are so tiny and not a big deal. Hallelujah. Okay, thank you, God. Okay, this is what we're talking about. I'll show you like in real person, but I don't know if you can see how much smaller that needle is than this one. holy frickin' moly. That versus this. Much different, much better. This one is like an IM, so it goes into your muscle needle. These ones are more sub-Q. So I thought they were all sub-Q. I'm about to find out. But holy frickin' moly. Hold on, she's here. Hello.
Hey, I'm Gaby.
Hi, Gaby.
How are you doing? How are you feeling?
I'm good. I am way more nervous than I was anticipating feeling. To be honest, like I was like, oh, this is fun. And now I'm like, holy mother, this is so many meds.
Yeah.
But I'm good. Otherwise, actually the meds literally just got here.
Perfect timing.
I know.
That's the best thing ever. That's perfect. That's
Yay.
absolutely perfect. The first thing I'm going to tell you, Sarah, is this process, you know, even as you're telling me like you're lying in bed, you wake up, you have these ideas, you're like thinking about it. It's a lot.
Yeah.
It's a lot, and it's different. It's not like other types of medicine. So in other types of medicine, you know, we have like set procedures. We know what the outcome's going to be. Mm-hmm. You know, tell you you're going to come back again. You're going to take meds for 2 weeks. Everything is kind of. With this, it's slightly different.
Okay.
Meaning there's a lot of unknowns in the process. You know, there's going to be like, we have to wait and see. We're going to tell you that a lot. Like, are we going to have to wait and see?
Okay.
And it's not that we don't know. Mm-hmm. You know, it's not that we don't know information. It's that we literally have to just wait and see what information you give to us and how you're responding. And then we make decisions based on that.
Okay.
So there is an element to it of no control. Mm-hmm. So that's, there is that element to the process, the unknown part, that's what I call it. Mm-hmm. And that part, we'll talk about how we go through it together and how we, you know, we deal with that aspect of the process. So what we're doing is just for the month, just this month's eggs, not the rest, all your eggs, just this month's eggs. Okay. We're going to grow them to ovulation size, and we're going to take them out and then freeze them for future use. Mm-hmm. So how it works is that I'll be taking injectable medications, and these injectable medications help us to recruit and develop follicles. Okay? Mm-hmm. The follicles are what hold our eggs. So we hear the word follicle a lot. We don't usually say eggs. We say we see 10 follicles. We have 5 follicles. Again, the follicles what hold our eggs. So the idea is once we take out the follicle, we could get 1 egg. Sometimes there's no eggs in the follicle. And sometimes also what happens is that it can be more than 1 egg. It can be 2.
We like that.
Yeah. Well, you take medications every day. And then what happens is you'll come in for a monitoring visit where we do a blood test and ultrasound. Mm-hmm. How you respond. Mm-hmm. So the whole process takes around 2 weeks.
I have my calendar. Yes.
And on the calendar, it says, okay, so you're going to come in for an ultrasound and blood test. Then it tells you that tonight you're going to start medications. Mm-hmm. And it gives us the dosages for the medications. Mm-hmm. But it gives us the dosages just until you come in on Saturday.
Got it.
Then if on Saturday, it says that 2 of the medication dosages are blank. Mm-hmm. And that doesn't give us any other information. All it tells us is that you'll have a retrieval between the dates of November 10th to the 14th.
Okay. I'm blocking out those days.
Okay. But it's all tentative, meaning that it could fall in these days. It could be earlier. It could be later. It could be on the Monday after, you know? What is that? The 17th. It could be on the 17th. Okay. So it's not, these are all just, it's a method for people to have a little bit more control of the process and understanding of what we're doing.
Okay. I like that.
So what we're going to do is I'm going to explain to you the medications first. So how does the doctor come up with a protocol regimen for you? Mm-hmm. They take different variables. So we look at a patient's age. We look at your AMH, right? So we look at blood testing, day 3 blood testing. And we also take a look at your ultrasound to see an antral follicle count. Mm-hmm. It's not just one aspect of us that we look at, not one result. We look at the whole picture, and then we determine, Dr. Ghadir will determine what's the best regimen for us to put Sarah on, because you're the focus, Sarah, for us to get the best results that we can for you for this month. Mm-hmm. So this is the regimen that we've started off with. So how it works is that you'll be taking the first medications called Lupron. Mm-hmm. Your first shots tonight.
Okay, perfect.
You're going to take it in the evening tonight, the 20 units. Then you'll move to tomorrow. You do 20 units in the morning, the 20 units in the evening.
Okay.
Then on Wednesday, you're going to do the 20 units in the morning, the 20 units in the evening. You see it says continue Lupron AM PM. Then it has the other medications, the Follistim, the Menopur, the Omnitrope.
Okay.
So Lupron, you're going to continue at 20 units unless we change it for you. We tell you otherwise.
Okay.
Okay.
Yep.
So what Lupron does is it has two methods of what it does. First, it works as a stimulant, so it helps your follicles to grow. Then it works as an antagonist, and it prevents you from ovulating by yourself.
Okay.
So that's the goal. The goal of what we want is we want, again, your follicles to grow to ovulation size, and then we want you to ovulate by yourself. Mm-hmm. We're going to make that happen for you.
Okay.
So then you're also going to be on Follistim. Okay. That's the hormone that we naturally produce, FSH, our natural hormone. Mm-hmm. Menopur is also hormones. That's FSH and LH. That also helps us to recruit and develop follicles.
Okay.
And we take Omnitrope too. Omnitrope is a growth hormone. It's actually what athletes take. And it's not actually made for fertility, but it's been proven to help with the process. So that's what we give it to our patients. Okay. And you'll be on that for only 8 days.
Okay. All of which are injections.
All of them are injections. Okay. Then what you do, you also have a medication called Novrel, and I'll explain that to you. That's your trigger shots. You'll have 2 of those. Mm-hmm. And the only oral medications that you're going to be taking is antibiotics. Mm-hmm. Okay, so that's the names of the medications that you're going to have, and I'll review each one with them with you in detail.
Okay.
So then what we need to discuss is where we do the injections.
Mm-hmm. And they're all separate syringes?
Everything is separate. So it's a total of 5 injections a day.
5 injections a day, because there's
Because you do 1 in the morning. Starting on Wednesday, it's going to be 5 a day.
Got it.
Because you do 1 in the morning and then 4 in the evening.
4 in the evening. Okay, 5 a day.
Yeah. Okay, so then now that I named you the medications, an important part of this process is organization.
Uh-huh.
Because it's a lot.
Yeah.
We have the phone that you can call us, or we have the portal you can send us messages.
Okay.
And we routinely check both throughout the day.
Okay, great.
If there's something after hours that you're like, I really need to speak to somebody, there's always an on-call nurse that you can speak to about it.
Okay.
So where we do the injections.
Okay.
So we do the injections. If you looked at the videos, you know, they're all subcutaneous injections. Mm-hmm. I know you're a nurse, but I'm just going to pretend like you're not.
Yeah, pretend I'm not. That's totally fine.
Pretend like you're not.
Yeah, I don't know anything.
The syringe, what's a needle.
Great, great. Well, and I saw this one come and I'm like, oh, that's like big. That's not sub-Q.
They're all sub-Qs. They all just have to go through your stomach.
Okay.
Stomach. Through your skin, under your skin. Mm-hmm. Every day you're going to pick a side and you'll rotate. So for instance, tonight we're going to pick your right side to do the injections. Mm-hmm. Then tomorrow you'll do all the injections below the belly button. So tomorrow you'll do your Lupron the morning and evening shots below the belly button. Mm-hmm. Then on Wednesday we're going to go to your left side.
Okay.
And you're going to do all your injections on the left side.
Okay.
Your injections don't have to be in the exact same spot. It's just an area. We just want the 3 areas to have time of a break. Mm-hmm. So now timing of the medications. So we've reviewed the names of the medications. We reviewed where we do the locations of the medications. Now the timing. Mm-hmm. So we just tell all of our patients 7 to 9.
Yeah.
It has to be in the evening time that you do them. Between like 2-hour window. If you want to do from 7 to 9 or 7:30 to 9:30, 8 to 10, 6 to 8, doesn't matter to us. It's just what works best for you.
Okay.
It has to be consistent. So you can't jump from like 4 o'clock in the afternoon to 10 o'clock at night. You can't do that. It has to be consistent. So pick a 2-hour interval in the morning to do your morning shot and a 2-hour interval in the evening.
Yeah.
So how it works is that you'll start the medications and then you come in for monitoring visits, right? That's what we said. You're coming for your first monitoring visit on Saturday for a blood test and ultrasound in the morning.
Okay.
We go in the afternoon and then you do your shots in the evening. So there's always the 3 times a day. Morning appointment, afternoon call, evening shots. So the side effects of this process, there's 2 parts. There's the psychological and there's the physical part. Mm-hmm. So let's look at the physical part of it first.
Okay.
So physically, you're going to have a lot of symptoms. In the beginning, you're not going to feel anything.
Okay.
For the first 5 days. You're going to wait for it. You're going to like, is there I feel anything? You're not going to feel anything. Then slowly you're going to feel some changes. You can feel, nauseous. You can feel tired. You can feel uneasy. Then you can start to feel a little irritable. You can feel irritable. You can feel emotional. You can start crying for no reason. So you've heard that people can get kind of crazy.
Yes.
But that's person to person. It's kind of like you're getting your period and then all these emotional changes, hormonal changes that you feel. It's like when you're about to get your period, you get uncomfortable, then you get your period and you're uncomfortable. So this is that, but on steroids.
Okay.
And then what also can happen is you can start to feel really bloated. Yes. And you're going to feel very bloated and uncomfortable. Well, the reason why you're going to feel bloated is because our pelvic area is like a glass Pyrex. And it's not built to have 20 follicles to ovulate, right? Because that's basically what our body thinks is going to happen. It's not built for that. So when you're feeling all these bloatings, there's a lot of fluids going to the area and it can't hold it. So you're going to feel bloated and uncomfortable.
Yeah.
Another reason why you're going to feel uncomfortable is because our ovaries, even though they're really small, they're like the size of an almond, they've never had this much attention before. Like they've never had this much excitement. And they're going to get really plump and big, and their volume, because they're kind of like, they're almonds. So they're like circular.
Are they seriously the size of an almond?
Yeah, they're really small.
I did not picture that.
Oh yeah, an unpregnant uterus is just this big.
Right.
And just know that whatever you feel, it is temporary. So it goes away. The ending is when you're going to feel the most of the side effects of everything. When your body's really plump and your ovaries and all of this. And our ovaries are also very tender. So you're going to feel that part too. They're like men's testicles. They're as sensitive, but they're inside of our body. And then the next part is the psychological part of it that I personally speak to all my patients about. This process does get very difficult at times. And so one thing that I was also going to tell you, the two main things is you can't have intercourse and you can't exercise after Saturday.
Okay.
Okay. The reason why we can't exercise is because the ovary, like no yoga and Pilates for sure, but because your ovaries, they like dangle, right? They're attached to the uterine wall and they dangle. So if they flip, that's very dangerous.
Yes.
So that's why we just tell everyone no exercise.
Got it. Okay.
So then we tell everyone that we can also do intercourse because the penetration. So you can have orgasms, you just can't have any intercourse. But every day you need to do something about yourself for yourself because it's going to get a lot. So you need to find something. If you like to journal, if you like to play music, if you like to, whatever it is that you like to do that for yourself on a daily. So find what works best for you. And I do really encourage daily walks. It's important to get outside every single day and go for a walk. If it's for 30 minutes, 20 minutes, listen to a podcast or something. But every day you need to, because you can't exercise, you need to do something physical every day for yourself. Yep. There's a lot of things in the process. There's a lot of steps. But I would say we're going to go step by step to the end of it. So we did the first step, right? We got your medications. Now we're reviewing your calendar. So now we can start the meds.
Caffeine. They said one cup a day, but how many milligrams are we talking?
Just a regular cup. That's what I always tell people. Just like a grande at Starbucks.
Grande at Starbucks. Perfect. That is all the questions I have for now.
So now we're going to go over the meds for me to review how to do the medications with you.
Okay. Perfect.
So let's get them out. So the first one that we're going to review is the Lupron.
Okay.
It's like this. It's a vial. We want to squeeze a bigger surface area that you can squeeze, the less likely this is going to hurt you. And then tomorrow you do the same thing. 20 units in the morning, 20 units at night.
So it's a multi-use vial. So I get one and I'm just pulling out 20. One
of these will last you the entire time.
Perfect.
So only one of these. And again, you always do 20 units. And you have to use a new needle each time. Don't reuse them.
That's why I have so many.
The second one that you have is Follistim. Follistim is a dial-up pen. So this is the pen.
Oh, it's cute little guy.
Yeah, exactly. It comes in a little box. Then you open that up, and there's a pen this inside of it.
Got it.
Okay. Then you have boxes that's probably in your fridge with cartilages in them.
Okay.
So we're going to start off using the 900 unit cartilage because you're going to start at 225. So if you're going to be doing 225 units every day for 4 nights, that 900 will last you for 4 nights.
Okay.
Exactly. So again, we squeeze, we pierce, we push.
Squeeze, pierce, push it all in.
Pull out, release.
Let me recap. 20 units out of the same vial, rub, the sub-Q with the insulin needle for the Lupron twice a day, morning and night, 2-hour window. Then I have the Follistim. I've already loaded the 900. Either way, it doesn't really matter if it's the 900 or the 300 one, but we'll start with the 900s, work those out, and then connect my little tip, whatever, dial it up to the dose that it tells me to do. Same thing, pinch, bam.
Bam, you got it. That's it. Okay, so now we're gonna move on to the next medication, and that is Menopur. Wait, what? I'm like, okay, we're gonna focus. So how Menopur works is it comes in vials of powders and liquids. So when you open up that box that you have.
If people weren't a nurse, this would be like very complicated.
Yeah, it is. It is. And they
no wonder they call you all the time. I was like, that's so much. But now I'm like, I mean, I think I would probably call you.
The first time I taught me how to do this, I was like, before when I first started fertility. Yeah. This is like really confusing.
Right. I mean, there's
if I was a random person and I had to know how to like use a syringe, I would have like hyperventilate.
No, completely. Thank God. Well,
okay, so when you open it, you have vials of powder and liquid.
Okay, so let me show.
Cap is the powder. And the gray cap is the liquid.
So powder here, liquid here. Powder, liquid, got it.
Exactly. So this is how we're going to mix it. What you're going to do, we can actually practice with your extra liquid that you'll have right now. We can practice, you can do something so you can feel like you're understanding.
Totally.
Yeah. So what you need is 2 vials of powder, your 1 vial of liquid.
Okay, so normally it would be.
Normally, yeah.
2 vials of powder, 1 of liquid.
Right.
Okay.
And then you need a Q cap.
Got it.
And you're going to you have syringes, I believe, with big needles attached to it.
Yeah, those are the ones that freak me out.
You just showed me,
I was like, I am not giving myself this shot.
You're not giving yourself that shot.
Thank God.
And then you also need something that came in these small needles. I think that says 27G on it, a 30G. You also need one of those. What to do is you're going to open your package that has the big needle and the syringe attached.
Okay.
You don't need this big needle. You just need the syringe from it.
Okay.
So you open it up and you just elbows to yourself and you just twist off the needle. Perfect. You have that. So what we're going to do is we're going to practice with you just drawing up the liquid. Okay. So you have your vial of liquid. You flick off the top.
I don't know if they can see this. Focus. There we go. Flick off the top.
Then what you do is you go to your Q cap. You peel off the paper that says Q cap.
Okay.
You open it up. Now your Q cap's in the plastic. Then what you do is you take the vial and you place the Q cap on top of the vial. So you have something like this.
Yeah.
And then you forgot your nurse. So you take it off.
Sorry.
Then you do twist on the end of the syringe. So now we just need a minimum of 1 ml of liquid.
Okay. Out of this is a 3 ml.
The whole vial or just 1 ml. And again, we know we're at 1 ml and the top of our plunger is at 1. You have to hold onto the plunger though, because otherwise everything will go back inside. When you're at 1, you're not going to do this now because we're just practicing with you. But what we're going to do is you take off the vial and you leave the Q cap attached to it.
Got it.
Then you go to your first vial of powder. You hold the vial with one hand. You pierce the top using the Q cap. You push down on the plunger so all the liquid goes inside. As soon as the liquid touches the powder will turn into a liquid. And what you do is you turn it upside down and you take out I'm practicing pretending with my vial of liquid. Then you put everything from inside the vial.
Okay.
When the vial of powder is completely empty, now we need to drop our second vial of powder. So you hold onto the plunger.
Okay.
You take off the first vial. Then you go to your second vial. You do the same thing. You hold the vial with one hand. You pierce the top using the Q cap. Then you push down on the plunger so all the liquid goes inside. Then again, you turn it back upside down again. Now we've made our mixture. So when the vial of powder is completely empty, you hold onto the syringe. Then you're just going to twist off the Q cap with the vial attached to it. So now our medication's all in the syringe.
Okay.
Okay. Then what you do is you want to make sure everything's done properly, of course. So the vial that what we left over with is a vial that has only a little bit liquid left because we only drew 1 ml. Then we have 2 vials of powder that had powder inside, but now completely empty because we drew it all.
So then I take my little guy.
You twist it on the end. Then you're going to take off the cap, and this is the needle that you're going to inject.
Okay. So.
The one thing that we have to remember, though, is we don't want to inject any air. So there's a little bit of air in my syringe. You see that?
Mm-hmm.
So we're going to prime the needle. So you push up slowly in the plunger so you get 1 or 2 dots of medication on top of the needle.
There we go.
When we have that, then again, we go to our stomach, we squeeze, we pierce our skin, and we push down. And you push and push and push and push and push and push till it goes in. Then you pull out and release. The next medication that we have is Omnitrope.
Okay. Omnitrope. Which is the little, well, these ones.
Yeah.
Okay.
So Omnitrope is probably in the fridge.
Yep, I found it.
Okay, perfect.
Okay, I have powder.
Yeah.
Liquid.
Liquid, yeah. So each powder and liquid, you're going to make a mixture like we did with the Menopur, but this mixture is going to last us for 4 nights.
Mm-hmm.
So I use the Q caps to mix this, and then you're going to draw up 25 units of medication.
Okay.
So again, pierce the top, turn it upside down. Let me get to 25. So this mixture that you've made, though, for the Omnitrope, it's going to last you for 4 nights. Put it into the fridge, and then the next night, all you have to do is you have to just drop 25 units. So you only have to mix it once.
Yep. Okay.
The Omnitrope you have enough of, unless you want to take it for 12 days, so I'll tell you.
Okay.
And the Lupron will last you for 2 weeks. Okay.
Amazing.
Nice to meet you. I know we
So nice to meet you. Yeah, no, it's awesome. This was actually extremely helpful. I'm glad we did it. I would have figured it out, but I would have probably had questions. So now it feels like I'm like...
You're going to still have questions, though. Ask me questions.
Okay. Well, that was a lot. I am so glad that they do this medication session with Gaby, their nurse. I am a nurse, and I said this on the call. I don't know how somebody knows how to do this on their own. Like, thank God I have like a basic meaning a strong understanding of medication administration and mixing and dosages and whatnot. But this is more complicated for the average person. So I will show you my entire process. I will kind of give like a little tutorial for those of you that maybe are doing this, and if you might find that helpful, because this is like so intense. There are so many medications. I'm literally like surrounded. Look at this. So I'm gonna figure out some sort of like organization process right now. Some of them need to be refrigerated, so I'm gonna figure that out, and I need to like get my head on straight to get all my medications organized, because for the next 2 nights, I think it's 2 nights of Lupron, that's it. It'll be easier, but then starting Wednesday, I have like 5 injections a day, which is insane. But I'm feeling better about it, and honestly, she said I'm not gonna feel anything really for 5 days, and then after that, the side effects get worse, and that's really what I'm worried about as far as getting through this birth. So after that, I'm off call, and I'm so grateful to be off call. So let me get organized. I just got my Lupron, which is my first med for tonight. I'm actually going to dinner at a friend's house, so I'm gonna do this from a friend's house. So I'll have some moral support, and I'll have some like help filming. So I'm gonna open this up and see what's inside, and then grab all my supplies and pack them up for tonight, for this evening, for my first injection. Help. So many more syringes. Another Sharps container. A whole nother bag of insulin syringes. Well, thank you, MDR. So this has to be refrigerated. You can see it comes in this little vial. Goodness me, it's childproof. Oh, can't get it open. What do I do? Oh, got it. I'm gonna keep it in this like refrigerated thing for travel, and then I'm gonna grab like a little cooler. Ready to go. We're setting it up so that you can see everything. These are my meds. All I have today is Lupron, 20 units. I'm gonna draw it up. I'm gonna give myself my first injection. Honestly, I'm way more nervous about the side effects than I am about the actual like med prep, and I'm a tiny bit nervous about the actual like poke of it. I've done this before. I remember doing this in nursing school in my stomach and being like, oh, not so bad, but we'll see how it goes. So I have my Lupron. Get it open. Very childproof. Okay. I feel like I should wash my hands. That's what I would do as a nurse. So my syringe has been refrigerated. This is all it is. It's super small. That's it. I'll show you the needle. So that entire needle is gonna go in my tummy. I'm just gonna stab myself as fast as possible, but it's really small. Like this is not so bad. Okay, compared to what it could be, especially as a nurse, I'm like, I've given some shots. This is crazy. What am I doing with my life? Okay, so I'm gonna show you. So here it is. I'm drawing it up to 20 units and making sure there's no air in it. So you can always draw up more and then push it back in. So I'm like literally, that's 20. Okay, here's the 20 units. Dr. Ghadir, I'm doing it right. She said 2 inches from my belly button on either side. So like over here somewhere, doesn't really matter. I just have to grab my fat, rub it off. This is crazy. I can't do it. No, I can. The needle looks a lot bigger when you're sitting here looking at it. 1, 2, 3. Oh my God. Oh my God. Okay. All done. All right. That's all I got. This is so gross. I hate putting my stuff down in public places.